I think there are certain mothers that don't produce enough milk. I think it's a very small number, and it certainly is of concern if they're not followed and picked up and that a baby gets into trouble. That's a real tragedy, and I think the Wall Street Journal certainly mentioned some of these babies, and they were very tragic cases. On the other hand, it seems that it was a very skewed article in that I don't think the article was really about breastfeeding, which was the focus of the title, but it was really about poor follow-up. These babies were not followed adequately, and the mothers who do have an insufficient milk supply, even though they're few, need to be picked up very quickly. And that simply didn't happen with the babies that were featured in that article. So I think it gave the public a very odd and a very unfortunate view of breastfeeding. And it was not about breastfeeding. Right, well, there are some ways, but it certainly is very serious. If a baby doesn't get fed, and that's whether it doesn't get fed by bottle or by breast, a baby will get into very serious trouble. And what we do is we try to teach our parents about how to figure out if their babies are getting adequate milk. And with breastfeeding, there are ways we can do that. One is number of wet diapers and number of bowel movements they're having. For a healthy breastfed baby, they have numerous bowel movements. Parents will make jokes about these explosive stools that come out of these tiny, tiny little people. But this is a good sign that calories are going in. So the parents know that if that's not happening, they need to call up right away and we need to see them. The scale is another place. We can weigh babies and find out if they're getting adequate food. But they need to be followed very early after they leave the hospital, and that's the part that's not happening. And that, to me, was really the gist of the Wall Street Journal article. I think that we do have mothers that often worry they don't have enough milk when they have plenty of milk, and that we need to take care of. On the other hand, to just say, oh, breastfeed at all cost. I don't know any responsible person in the field that would ever say that to a mother. We certainly encourage breastfeeding. We encourage exclusive breastfeeding, but we need to monitor the baby. And that's the part that wasn't happening in that article. And that's the whole issue, is that we need to know these babies are thriving. So nobody would say, I mean, formula has a place. It isn't often necessary, however, and that's what we also need to teach the public. But we do need to teach them how to have proper follow-up so that we know the baby's getting enough milk. I think that is a huge issue for all of us. Most of us in healthcare were not adequately trained in breastfeeding. And I know from having several children that are in medicine, they still are not getting that in current medical schools. I think that it isn't happening. So that is an issue. On the other hand, there are people that are knowledgeable that are out there. I think at our hospital, for example, our healthcare professionals have set up an excellent follow-up clinic so that we do see all of our parents. And that happens in lots of places in the country. So it is a problem, but we need a lot more education for physicians, for nurses, for the public as to how you help mothers succeed at breastfeeding and how you make sure that babies do get enough when they are being fed that way. And that isn't happening. We have a lot of knowledge that is still lacking out there. Well, the idea that breastfeeding is risky or a risky business is absurd. Formula feeding can be risky. Inadequate food is the risky part of it, and inadequate follow-up is the risky part. But as far as what's behind it, it's really hard to tell. I think the formula manufacturers have done a wonderful job of marketing. They've really had us all convinced that it doesn't matter how you feed your baby, even though they do make a statement that breast milk is best. Just in case, there's lots of things that set mothers up for a lot of doubt about whether they can adequately do this. So it's hard to say what's behind the Wall Street Journal article. I have my own suspicions, but they're not grounded in any fact. It was interesting, this article hit right during World Breastfeeding Week. There's a lot of anti-breastfeeding marketing going on. So I don't know if it was part of that. I thought it was just an unfortunate and an odd place for such an article to be at that particular time. But I don't know specifically what was behind it. Oh, the reasons for breast milk being a superior food for babies are just, unlimited. I mean, in terms of what we know now, that has nothing to do with what kind of mothers we can be. I think we've learned so much in terms of the science of it now, but breastfeeding really reduces the risk of ear infections, reduces the risk of respiratory infections, reduces the onset of juvenile diabetes for children. It reduces childhood cancers. But not only that, one of the other, I think, most exciting things we've learned in the last few years is that women who breastfeed actually have a lowered risk of breast cancer, ovarian cancer. Young adults who were breastfed have a lowered risk of Crohn's disease, ulcerative colitis. I mean, the list goes on. It's irrefutable stuff now, and we really have that. And that's been very reassuring, I think, for those of us in healthcare to actually have the science background. And formula doesn't provide any of those things. Formula will provide the calories, and we certainly know, probably many of us were formula fed, and that we can grow up healthy adults, and we can also be loved by our parents. And I think I get a little disturbed because you used the word earlier about militant and religious fervor or whatever, you know, and the article used those kinds of things, as if those of us who are promoting breastfeeding are somehow these militant, fanatical nuts that, you know, think a bottle should never cross a baby's lips. And that's been, I think, very unfair. It's interesting that nobody is critical of the formula marketing that really assures mothers that it doesn't matter how they feed their babies and that that is risk-free, because it surely isn't risk-free. Thank you for having me.